What's up guys, Dr. Joe here from IDPT, and today we're going to be talking about the best exercises to do after ACL surgery. This is a huge topic, there's a ton of content and a ton of information out there on this, a lot of content which I respectfully disagree with, and the reason I disagree with it, the stats support me because it says 55% of athletes who tear their ACL never get back to the level of sport that they were at. That's a staggering number, okay? And what I believe the reason for that is because ACL rehab typically only focuses on strength, focusing on getting the quad stronger, but that's missing so many factors of ACL rehab. It's missing how the hip, the knee, and the foot are moving. It's missing the fact that we need to get the swelling out before we even care about strength in the first place. And it's missing really what the athlete needs to do to get back to their sport. So what we're gonna do today is show you first how to get that swelling out of your knee less than a month. I'm talking fast. Then layer on strength. Finally, start training like an athlete. And typically when we train our athletes here after ACL rehab, we're training them harder than they even would in practice or a game, because that's the only way I feel we can really prepare them to get back. And that's why our athletes have so much success, and typically when they get back onto the field or back onto the court, they're actually performing at a higher level than they were pre-surgery. So if you're interested in this ACL rehab, you're gonna love this topic. Like, share, and subscribe if it resonates with you, and please enjoy the episode. All right guys, so the very first exercise that I'm gonna give any of my ACL rehab athletes is something called hook lying breathing. And hook lying is just the position that we're going to be laying in, and we do it for two reasons, and I'm going to show you. All right, so let me show you the exercise first. So you're going to lay on your back, put something between your knees that you're not squeezing, but it's there, okay? From here, you're going to tuck your pelvis and roll your hips so your low back goes flat to the ground. From here, we're going to slightly press our heels down to engage our hamstrings. We're going to hold here, and then we're going to do deep breathing. So we're going to breathe in through our nose and out through our mouth, and we want to feel our rib cage open and close. The reason that this works is twofold. Number one, after a surgery, your body is really in a heightened nervous system. So that's called the sympathetic nervous system, which is your fight or flight response. You're in a high stress situation, okay? What this deep breathing will do is start to bring that heightened sense of nerves down, and it's going to let your body relax and let your body heal. The second thing that it's going to do is, with a bent knee and a hamstring recruitment, we know that the hamstring's attached to the back of the knee, so it's actually going to help self-mobilize that tibia and that knee to start getting range of motion back pain-free. So what I like to recommend is I like to do 6 breaths at a time, and after surgery, I'm going to recommend like up to 6 sets at a time and doing, up to 3 times a day. So we're here, in through our nose, out through our mouth. The next one we're gonna do on week 1 are your old school quad sets, and realistically it's nothing fancy. We just need to start getting that quad working again. So you're gonna put something behind your knee as a reference point to dig into. I like to lay flat while I do them. Pull your toes towards you and drive your knee down. Hold for about 3 to 5 seconds and relax. I like to try to do 20 at a clip. An absolute bonus after the first week would be to put stim on your quad and get that muscle recruited even further. And you'll know you're making progress when you can really start to see your quad contract. All right, so starting week 2, I want to start focusing on the ability of this knee to bend again. Now, one of the biggest myths with ACL rehab is that it's going to hurt. And even PTs have crank days where they're going to crank on your knee to get the range of motion back and break up that scar tissue. That's something that is completely unnecessary, and it's gonna jack your nervous system right back up. So what we do is a pain-free way to start getting the swelling down and to start getting that knee to bend better. So you're gonna lay flat on your back and put the affected leg on the wall. And then you're gonna let this knee bend as your foot slides down as much as you can tolerate without pain. And then from there, we're gonna take our other leg and slide that foot up so that we're not breaking any protocols here. All right, so then we're gonna let it slide down. You can even hold that for a couple of seconds and then slide it back up. I typically like to go about 30 at a time, and I do 2 to 3 sets, but it's really something that's based on tolerance. There shouldn't be any pain, and we're gonna get a lot of mobility back and swelling to decrease. The next one that we're gonna do are heel slides. So you're gonna take this band and then you're gonna pull this heel in and crank on your knee hard. I'm just kidding. I don't want you to do it. That's how most PTs will tell you how to do a heel slide, is by cranking on your knee with a rope. No good. Just like I said before, we're forcing it into a position that it can't comfortably get in. Here's the IDPT way of doing it. We're going to get that hamstring turned on and make it an active exercise instead of a passive exercise. So you're going to lay on your back, knees bent. Make sure your whole foot is flat on the ground, and then you're going to slide that heel in as much as you comfortably can. Once we hit a point where you feel a restriction, don't go past that. Just really think about digging down and feeling this hamstring turn on. Hold that for 5 seconds and then release it. And then you're going to pull in, hold, get that hamstring going, and release it. I like to start at 10 reps, and then I like to work my way all the way up to 20 reps. Typically, we'll do about 4 sets of this. The last major important exercise for week 2 is continuing to focus on getting knee extension, but we want to emphasize having a foot contact because this is going to translate to our walking much more than just doing quad sets, in week 1 will. So what you're going to do is lay flat and have a very, very slight knee bend in the affected leg. From here, we're going to put our low back into the ground, and I want to push through the wall through the inside of our heel and the inside ball of our foot. That's going to engage our hamstring and might even engage our quad a little bit. And then we're going to hold that, okay? I want you to hold it for 10 seconds and then release it. And then push into the wall, hold, and release. You'll know you're doing this right if when you push, you're pushing yourself down into the ground. I don't want you to slide away from the wall and lock your knee out. That's going to be no good. So keep the same amount of knee extension the whole time. All right, so for week 3, we're starting to really put some more weight through the leg and build up the tolerance in it. So what I like to use is a wall squat hold. And here's the biggest, most important factor of this wall squat, is that you're going to take it to tolerance. We should feel no pressure or pain in the knee. So usually in the beginning, we're going to start at about a quarter depth, and we're going to hold right here. And we're pressing through the whole foot, not just our toes. Okay? And I want to hold this anywhere from 30 seconds to a minute, depending on what you can tolerate. Now, if you can get lower, I'd encourage you to do that. Typically, once you hit that 90-degree point is when you're going to start feeling some discomfort. So just ease off of that a little bit and come up a little bit higher. All right, now for week 4, we can actually start to progress that squat and start to use some weight. All right, so I'm going to show it to you body weight, and that's how I want you to start. But eventually, you can put weight in your hands and start to progress it even more. So I like to use a foam roller starting behind my lower back. Same foot position as the wall squat hold. From here, we're going to drop down again to tolerance and then come back up, pushing through the whole foot. Okay? Typically, I recommend starting at about 15 reps, and I like to build up all the way up to like 25 reps. When 25 reps becomes easy, that's when we're going to start to actually add weight to this. Another pro tip is if you can tolerate this in your knee, I want you to bring the affected leg slightly back. The reason for this is because now as I squat, I'm going to have more weight on that leg. This way I avoid any weight shifting or any compensation using the healthy knee. All right, guys, so moving on to around week 6, up to this point, all the exercise I've shown we're doing, and we're also upping the reps, we're upping the volume, getting us in better shape, getting us stronger with less swelling, okay? Now, if we think about back in week 2, when we started doing the supine cross connect, and the goal is pushing through the wall and getting force production off that leg again, well, we're gonna do that now, standing against gravity. So we're gonna use weighted step up, all right? So you're gonna put weight in both hands, and then you're gonna put the affected leg on the box and drive the opposite knee up toward your chest. And your focus is really on driving down through this inner heel, okay? Then when you step down, I don't want you to shift your weight backwards and take weight off the front leg. Keep your weight forward on your front leg and then drive right back up. So we keep the tension on that quad. Step down, drive right back up. Step down, drive right back up. Typically, it depends on the weight, and it depends on your goal. So I always recommend starting with less weight and more reps, anywhere from 15 to 20 reps. Really get that leg working. And then as that gets easier, we start increasing the weight and decreasing the amount of reps to focus more on pure strength. Another thing that I love in week 6 is now starting to work that hamstring in isolation, because it's going to continue to help us get our knee flexion range motion back. Now with week 6, we want to really focus on isometrics to protect the knee as we strengthen it. But as we get more into the week 8 area, that's when we're going to start, using more repetition and start focusing on pure strength. Okay, so if you have the luxury of having a machine like we do here, this is a home run. Okay, so you're going to lay on your stomach, and then what I want you to do is actually curl up with both legs. And then from there, you're going to drop the non-affected leg and just focus on keeping the hamstring engaged on the affected knee. Now, what I will say is it's going to produce pressure on the knee. So it's really important that we focus on really light weight here. We just want to start building tolerance in that hamstring. We are not trying to max out the machine. You'll put yourself in a dangerous situation. So again, it's really light for me. I'm on level 2 right now. And all I am doing is curling up, dropping the other leg, and then holding. If I still feel a lot of knee tension, lower the weight or simply change the angle. So you can change where the leg position is. Typically, I recommend trying to hold this starting at about 20 seconds and building yourself up to 45-second holds. Now, like I said, getting into that week 8 area, there's a lot more healing that's occurred. We want to start repping it out, and we're going to do what's called 2 up and 1 down. So you're going to curl up with 2, drop the non-affected leg again, and then slowly lower down. We don't want to go fully straight, but we want to get close enough, and then we're going to go right back up with 2 legs. And then we're going down slow again, slow, 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 right back up. Down slow, and right back up. So this is focusing on eccentric strength, which is the lowering phase of strength. And research shows that we actually produce more strength and get strength faster when we focus on slow eccentrics as opposed to just focusing on the curl in, which is the concentric portion of the exercise. So for these, typically I'm going to start pretty low because it's going to be really challenging, like 6 reps or so, and then eventually building up to that 10 rep range. Typically I'm trying to go like 4 sets. All right, so now as we get more dynamic, we're gonna go into a front foot elevated split squat. And realistically, guys, we probably could start this as an isometric around week 6 mark, okay? And so let me show it to you first, and I'll show it to you that week 6 exercise. So affected leg is forward on a step, typically about 2 inches high, and then your back heel is back off the ground. From here, I wanna drop down about halfway, and I don't wanna go so low that this heel is going to lift off the ground, because if I stay on my toes, it's going to put a lot of pressure on my knee. I want to keep that heel down and stay at a comfortable mark. From here, we're going to reach our hands out in front of us, because it's going to act as a counterbalance. So it's going to keep us upright. And we're going to hold right here. Typically recommend starting about 20 seconds, start building tolerance all the way up to 45 seconds. Okay. But now as we're on week 8, we want to start repping this out. So at this point, we probably have done some body weight. So what we're going to do is called a goblet hold. This weight is going to be out in front of us, okay? Same exact thing. This is going to act as our counterbalance, just like having our hands out in front of us was. And then from here, we're going to drop down, drive up through this front heel, stand up, down, and right back up. And what I want to recommend is starting at 10 reps and trying to build all the way up to 15 reps. If we're doing it right, we'll feel a little bit in the back leg, but it should be really burning our front leg. If you feel the whole exercise on the back leg, it means you're leaning too far back and not putting enough stress on the affected leg. Staying in this week 8 range, we're gonna start getting leg extensions. And the reason I personally wait so long is because the #1 side effect after ACL surgery is patellar tendonitis, so inflammation in the front of the knee. And I believe that's because people don't have enough quad activation and they jump to this exercise too early. And so if my quad isn't doing this, then the only thing that's left to actually support the weight is structural, and that's the patellar tendon. So I personally wait probably a little bit longer than most therapists. And the way that I like to start, we're gonna start it with isometric. So just like the curls, you're gonna kick out with 2, and then you're gonna drop the non-affected leg and hold right here. So if you notice, my knee is not like completely deadlocked straight. I have a little bit of bend because I'm forcing this quad to work, okay? From there, to progress that, we're gonna go 2 up, 1 down, focusing again, guys, on that eccentric component, the lowering, which is really gonna build up our strength fast. And then finally, once we're at about like week 10 or so, I like to see a single leg repetition up and down here. Really, really challenge that quad, guys. Trying to go as many reps as possible, just going until failure. But again, this is around that week 10 mark. There's still more exercises that are gonna prepare us for this moment that I still want you to do in week 8. All right, the next one for week 8, guys, we're gonna do a staggered RDL. So the reason we're staggering it is because we're going to be able to emphasize the affected leg more. And if you notice, I have weight in my hand again. So what's the theme? Week 8, especially for a traditional patellar tendon graft or quad tendon graft, week 8 we can finally start using weight. And guess what, guys? We're taking full advantage of that. We're moving weights now consistently. So with this staggered RDL, we're going to go right foot back, and the toes are going to be in line with the middle of my front foot. So it's a very small stagger. Again, toes in line with middle of the other foot. From here, we're gonna bring the weight to midline. We're gonna go soft knees, and then we're gonna push our hips back until we feel the back hamstring and back glute. A cue I like to give is push your hips back while feeling like you're trying to make your spine long. This is gonna prevent you from just trying to squat. It is not a squat. We're not bending our knees all that much. And again, we want to feel that back hamstring, that back glute. And I recommend 8 reps. And we're going to get a nice stretch in that back leg. All right, guys, this is the last one I'm giving for week 8. You can see how excited I am that we can use weights again. So what I'm going to do is an offset goblet squat, okay? The reason for the offset, what we're gonna do is put the non-affected leg on a very slightly elevated surface, only about an inch at most, and then the affected leg is gonna be off of the plate. The reason is because this is gonna naturally put our weight more on the affected leg and force us to train it more. Okay, from here, we're gonna put this weight out in front of us because it's gonna help us get more depth and push backward. From here, we're gonna squat straight down and emphasize mentally the affected leg and pushing through that leg. Okay, right here, up and down, and I'm trying to go for as many reps as I can, and I do not want to feel pressure in the front of my knee. If I do, you're getting too low or you're not ready for this. Okay, guys, so I wanna go as many reps as possible, starting at 2 sets and then building up to 4 sets. All right, guys, we're officially at the week 10 mark. What that means is that we're getting really close to 3 months. Okay, and again, for a traditional patellar tendon, quad tendon graft, 3 months, if we're doing the right things, that means that we're starting to get into plyometrics. And one way to be ready for plyometrics is to be damn strong. Okay, so now we've already been working weights for a few weeks. We're starting to go heavier, okay? So right here I set up a hex bar. Hex bar deadlift is one of the best exercises you can possibly do for just pure overall strength, all right? So what I'm gonna do, I'm gonna put on an appropriate weight, and I'm perfectly happy, you know, throughout the process of slowly building up the weight. I don't wanna just jump to a heavy weight, okay? And this is gonna be a combination of an RDL and a squat. So we're gonna bend our knees a little less than we would a regular squat, but we're also gonna push our hips back. And then from here, grab that bar, drive through the ground, tap, and go. Okay, we're gonna start at 8 reps, and we're actually gonna go down in the amount of reps we're doing as the weeks move on, because we should be going heavier and it should be getting more challenging. Like I said, guys, we're coming up to the plyometrics mark, okay? And to be ready for plyometrics, we need to have the form down, and we need to start priming our body. So we're gonna do that with an exercise that I love called snap downs. And what snap downs are a way for us to learn the right form for landing. Okay, so we're not jumping yet, we're staying safe, but we are starting to understand how to control our body. So the way that we do a snap down is you go on your toes, heels up off the ground, hands go into the sky, and then from there you're gonna snap down quick and land. And when you land, I want hips, knees, feet all in a line here, okay? If you see your affected knee diving in, we need more strength, we need more stability in the leg before we're ready to get into the plyometrics. Congratulations, you just hit month 3, and you see how fast time flies when you're having fun with IDPT. So now we're getting into more of the plyometric component, but here is going to be a test to see how ready you are for that. So we did the snap downs, we know how to land. Now it's time to actually put it into practice, okay? So I'm using a pretty low bench here, okay? A few inches off of the ground, okay? So what I want you to do is step up. what you're going to do is you are not going to jump off of this box or bench. You are going to step off, okay? When you step off, you're going to land on both feet just like we did with the snap downs, okay? So I'm going to lead with one leg, and then when I land with both feet at the same time. Bring the arms down, load the hips, knees, feet all in a line. Okay, let me show you again. Another huge factor is keeping it quiet. I should not hear you land loudly. That means you're not controlling it. Okay, so I'm going to step down, soft landing. Now, if your knees collapse in or you can't keep your balance, you may not be ready to go to the next exercise, which is going to be a box jump. But let me show you one more time. Go ahead, step off, land on both, soft feet, and we're slowly building the brakes on the engine, and now we're going to hit the gas. All right, so the first box jump variation that we're going to go over is a seated box jump because it gives us more control. It's a little bit safer in the beginning. Pick a height that's low so you can get really comfortable landing, okay, and jumping, right? So like, we have plenty of time to progress the height. Do not try to be Superman and pick the highest box you can find when you haven't even done this. Start low, get your confidence, get your swag back, and then we'll focus on building it up. So what I'm going to do is start. I'm sitting on a bench. I have a box decently far out in front of me. Now, just like our snap downs, we're going to start with our arms up, snap down, jump, land on the box again. So it's basically 2 snap downs, okay? So we're going to go hands up. We're going to sit back here really low, leaning your weight a little bit forward. So we're here, lean forward, come up, land softly, step off safely. Okay, again, so we're up tall, snap back, get up, land here. All right, typically I only recommend about 4 to 5 reps, and we're going to slowly work on building up the amount of rounds. I do not want you to fatigue out or get really tired on these. All right, guys, now we want to start building up that springiness, getting the pliability back in the ankles, and we want to do it by decreasing the amount of weight going up and down. So we're going to use this band to basically create an at-home trampoline and basically make us lighter so it's less stress on our knee. Okay, so what you're going to do is tie a nice thick band up to like a pull-up bar or something up high, and then pull that band down to your chest. Okay, I like to start for 20 seconds, and then we're going to build up to 30 seconds. It's all ankles. Our knees are nice and soft, and all we're doing is working on getting springy again and just getting used to that little pop in our system. One of my favorites personally. All right, guys, so we're at 3 months, and I know what you're thinking. When can I start running? You're this close. Around that 3.5, 4 month mark is when I recommend my athletes running, and you're right there. But we want to make sure we're doing it right, make sure we're staying safe. So in order to worry about going forwards, we need to worry about starting backwards, again, building the brakes so that we can hit the gas running. So what I do is a backward walk variation on a treadmill. So what I like to do is jack up that incline. Typically, I'll start it at around 6 incline. We can move up. You're going to hold on to the side rails, and then you're going to drop into a nice squat. Try not to use your arms so much. It's just there to support you. And then you're working toe to heel, going backwards. And you're going to feel like it's kind of easy in the beginning, but that's why we're doing it for a while. So I typically tell my athletes, we're starting doing it for a minute and quickly working up to 2 minutes, even up to 3 minutes at a clip. And don't worry, guys, you're going to start feeling that quad burning and burning and burning. So we're going to stick with this for about a few weeks, and then we're going to start hitting the treadmill. It's finally here. We're going to run. All right, we're about 3.5, 4 months in. It's finally here, and you earned it because you've been putting in the work. Okay, now I'm starting on a treadmill, and I'm going to tell you how we like to start it here, but that's because we're in the Northeast and it's the dead of winter. If you have access to a track and you can do this outside, I'd highly recommend it. What I would not start with is the first time you're running is to be on a sidewalk or the street, because there's a lot of unevenness and you're really not prepared for that just yet. I don't want to throw in external factors, so I want to keep everything nice and flat and easy. All right, now for a treadmill, I personally like to start it at a 1 incline. And that's just because if it's completely flat, we are doing a fair amount of pounding that we're not used to. So by just raising it up a little bit, it's going to take some stress off of our knees. So I'm going to put it onto that 1 incline, all right? And we're going to start with an interval, and I will drop the interval in the description below, both for the track and on the treadmill. but it's going to be alternating between a walk and a run. So let's run. Oh, and it feels good, guys. All right, so we're going to get a sled march, and I recommend starting light so we don't have a ton of stress on the knee, but then quickly building up on the amount of weight that's on the sled. This is a great option because it's going to get you strength, but it's also going to start working the patterning and start getting you feeling like an athlete again. All right, so you're going to go arms straight into the sled, drive your knee up slightly, strike through the ball of the foot, and drive through that back leg. Guys, I typically recommend starting at about 20 yards at a clip 2 to 3 times and then start to build up. So if you don't have the space, then just do more reps. But if you have more than 20 yards, you start building up to 30, 40 yards at a time. So we start getting into more sport-specific stuff around month 6. So that being ladders, cutting, all change of direction things, right? So from the period of that month 3 to month 6, we're just doubling down on everything that we've gone over to this point. We're doubling down on single leg strength. We're doubling down on heavy compound movements. And we're doubling down on the running, the jogging, the plyometrics, just all things to get us prepared for that month 6 mark of that sport-specific drill. And then once we start hitting that sport-specific around month 6, we're tripling down on everything, and we're continuing to run drills, cutting drills, acceleration, sprinting, all of those things from month 6 to month 9. Typically for my athletes, that month 9 is where we find on average that's when they're ready to start getting back to their sport, getting involved in practice and drills again. So there you have it, guys. There's a complete guide to know what exercises you should be doing. And if your ACL rehab and PT right now does not look like this, send us a message and let us help you get right. And if you haven't gone through rehab yet and you're wondering, what should I be doing? This is going to cover everything, guys. So please follow along. And if you found this helpful, please like, share, subscribe, and I'll see you at the next episode.